Good morning. It's good to be here. Let me get the little slide clicker here. Do we have the slides? Not yet. Okay, they're coming. How's everybody doing? It's really good to be here. It's good to come to Utah. Sean and I, my fiance, when we want to escape Nevada and Las Vegas, we actually drive to Utah. We don't make it as far up to Salt Lake, but we get up to St. George, and I love this state. I love the beauty of this state. And I'm really grateful to be here with you all today. There's few places that I would rather be. I get to be one of the gifts and joys of my recovery journey and work and advocacy is I get to travel all around the country. I get to meet with folks. I get to talk to policymakers, work with families, RCOs. But I always feel most at home when I get to spend some time with peers, because it's each and every one of you, who are on the front lines. You're doing the hard work, the hardest work, in my opinion. I believe, each and every one of you and the work that you do is really the solution of how we pull ourselves out of this catastrophic overdose crisis. One of the things that I advocate for and we advocate for in the advocacy movement is really a more robust infrastructure for peers, training, good paying jobs. Peers should be paid well for their work. These are things that we are working on day in and day out. It's important for me also, though. I know I've got a short intro, but I have to kind of introduce myself too, just for my own recovery identity. I'm Ryan Hampton. I am a person in long-term recovery. To me, that means I haven't felt it necessary to have a drink or a drug or any other mind-altering substance since February 2nd, 2015, because of my recovery and the people who have supported me and lifted me up when I couldn't lift myself up. Many of them peers. Today I'm able to be a good fiance. I'm getting married next year, which I never would have thought would have been possible. I'm able to be open about my relationship with Sean, which is also something that I didn't think would be possible. I have a dog who I love very much, who's basically our child. He's a big baby. He's an 11-year-old pit, and I love him more than most things in this world. I'm a taxpayer, which is also just absolutely insane. And I've been able to start a couple of organizations. One, the Voices Project. The other one, the Recovery Advocacy Project. And an initiative called Mobilize Recovery with a really good group of people in recovery from around this country. So I think, to kind of set the table for some of the things that I want to talk about during our time together, I just want to kind of just do a quick primer on the landscape, right? I don't think it's a shock probably to anybody in this room, and anybody, by the way, welcome to folks who are watching on Zoom, that the way that we deliver and the way that people receive peer services, addiction treatment services, recovery support services, that landscape has completely changed as a result of the pandemic. Even today, right? Even as we're starting to kind of see, things being a little bit more rosy. This was a study that was done in the midst of the pandemic in September of 2020. A very reputable online journalism source called Morning Consult got together with the National Council for Mental Well-Being. It used to be called the National Council for Behavioral Health, and did a survey of addiction treatment providers, behavioral service providers. And what it found, and these numbers probably aren't that striking to you, being that you're on the ground doing this work, but that the demand for behavioral health services was increasing. 52% of behavioral health providers saw an increase in the need for demand during the pandemic. But at the same time, the capacity was for providing these services was diminishing. 54% of organizations had to close their programs. 65% of them had to cancel, reschedule, or turn away patients. The viability for these organizations and the care for millions was at risk of disappearing. During the pandemic, organizations lost on average nearly 23% of their annual revenue, and close to 40% didn't think that they would survive for at least 6 months ahead of them. So the American Rescue Plan, right, it was helped to alleviate some of these problems, but certainly not all of them. There were over 1,000 addiction treatment providers in the United States that had to close their doors permanently. Permanently. Now, some of them have started, there's been a few that have reopened, but we lost a lot of good providers, a lot of good mom and pop shops, a lot of people who were providing addiction treatment services because they just couldn't sustain themselves. And I think, going through these numbers and where we're at, it rings really true to me. And one thing stands out is that the recovery community, folks who are on the front lines, not just the recovery advocates and recovery folks who do recovery advocacy, but peer workers, people who work in addiction treatment, family members who are impacted, right? Anybody who has, that's within our orbit that cares about this issue, we have our work cut out for us. We have our work cut out for us. And this blue box down here will tell you why. This data is updated, this preliminary data coming from the CDC is updated about every 5 to 6 months. These are the most recent numbers that were released 3 weeks ago. It is estimated that 107,622 souls, American souls, lost their lives to a preventable, and I'll say preventable with a big underline exclamation point next to it, overdose last year. And that number just continues to soar. Now, let me tell you why this makes me really angry. Because I see this number, it makes me sad. Look, I got here last night. As many of you have the same experience. 2 calls last week, people I went to treatment with, one that I had lived with in early days in sober living, dead from overdoses last week, right? Like you almost get numb to it at a point because it's happening so much, right? And then you see the aggregate of what's happening around the country and it makes me angry. And I'll tell you why it makes me angry. Because I have to ask our policymakers, right? Our legislators, right? The people who make decisions about our community, what is the magic number, right? What is the magic number? Because I can remember when I got sober, when I got into recovery in 2015, it was 47,000 overdoses. These are just drug overdoses, by the way, confirmed drug overdoses. This number does not include alcohol. We know that drug overdose data is underreported to for a variety of reasons. If you take into account the underreporting of data and the alcohol deaths due to alcohol, that number is closer to 400,000 just last year, right? But we only hear the 107,000 number because that's the confirmed drug overdose number, right? I ask myself and policymakers, what's the magic number? 47,000, 2015 to 2016 when I got sober, and we were hearing that this was these were historic numbers that, we had to do something, right? I remember President of the United States that year with President Obama in his State of the Union said heroin. He talked about the quote-unquote heroin crisis that was happening, right? We had members of Congress that were rushing to the table to, get in front of microphones and talk about how they were going to solve this. We had, we were in the midst of a presidential election in 2016, and it felt like every single person running for president of the United States had a plan for how they were going to combat the overdose crisis. Republican, Democrat, Independent, across the board, right? everybody was going to, there was a sense of urgency. Yet, the next year, that number goes up to 56,000, 72,000, 84,000, 96,000, 98,000, 102,000 6 months ago, 107,000 now. What's the magic number for people to start taking our community seriously, right? What's the magic number for them to actually start listening to us, peers in recovery, right? People who are on the front lines, who do this work where we know where these gaps are. And what's the magic number for them to actually put their money where their mouth is, right? I don't want to go too much in a tangent on this, but it is important to set the table. And I am going to bring up COVID. I'm going to bring up COVID not around any politics around it, but I'm going to bring up COVID just as a comparison, because there are two federally declared public health crises in the United States. There's two, only two, declared public health crises by the President of the United States. One is COVID-19. The other one is the drug overdose crisis in this country, right? One of them has received over $3 trillion in funding to combat. This is not to take away from that, right? When COVID hit the scene, we had a vaccine within record time. We had public health resources on the ground. Hospitals were getting infusions of cash. Small businesses were getting infusions of cash to stay open. We had broad public education around what to spot for and how to protect yourself and how to mitigate anything from COVID. We had prevention measures seemingly overnight, right? I mean, when we hit 50,000 COVID deaths in the United States, there was a daily White House press briefing that was covered by all the national networks on what we needed to do. We had real-time data tracking. Like, look, you could still go onto Google today and you'll know exactly how many people have been vaccinated, exactly how many people have tested positive for COVID, exactly how many people have died from COVID within a 24-hour period. Like, you could look and find data from 2 days ago, right? And you can have it real time. Pharmacies, right? Pharmacies were employed with all sorts of measures. Yet, drug overdose, right? The other declared public health crisis in this country receives over 1,000 times less money than the COVID crisis, right? It's still this highly stigmatized issue that nobody wants to talk about, that if we don't start taking the lead on, right, which means we as a community have got to get louder, we're in deep trouble. Like, we're in deep trouble. These numbers are not going to plateau anytime soon, and I'll get into the reasoning for that a little bit later. But it just goes to show you that we, people in recovery, peers in recovery, people who are impacted by addiction, family members, like, we can't wait around for others to come save us and make this happen. Like, we have to start getting loud. We have to organize, which is something that's new to the recovery community and the recovery movement. And we have to start demanding that these policymakers actually put some weight behind these talking points that they give us from time to time, especially in a year like this year when we're about to come up to an election. Everybody wants to talk about what they're going to do for us, but then many of them will go away and we'll see them again in 2 years, right? I mean, I'm sure a lot of you are familiar with that. I know I am. So let me, I'm going to go into the next slide, and whoops, that goes back, sorry, getting used to this. So I want to talk a little bit about where my values come from, why I believe, in the power of our community, the recovery community, people with lived experience to combat this pressing national health crisis. At my heart, I'm really a community organizer, and this is just, I know this is there's a lot on this board here, and I'm not going to go through all of it today, just in the interest of time. But this is really kind of a 101 to community organizing as an illustration. The first time that I saw this, and I went through a class several years ago at Harvard Kennedy School around community organizing and how we could utilize these tactics to help support people in recovery and the recovery community. I was fascinated, right? In that introduction to community organizing, I was given a new definition of leadership, which I believe each and every single one of you are. You are leaders within your community. You are leaders within the recovery space. You are leaders amongst your peers. But redefining leadership was something that was important for me in going through this work. I've gotten a lot of definitions of leadership over the past, but for anybody who takes notes, this is one to write down. I have it pasted right above my desk. I look at it every morning. According to kind of the Organizing 101 principles, leadership, A, means building more leaders. Leadership is about building more leaders and lifting others up. The definition is accepting responsibility for enabling others to achieve a shared purpose under conditions of uncertainty. And I'm going to repeat that. Leadership, as a definition, accepting responsibility for enabling others to achieve a shared purpose under conditions of uncertainty. And that rings really true to me, in the recovery space. Let's just break it down for a second. We enable others, right? We need to enable others to do this work who have a shared purpose. And there are few issues in the United States. There are few issues in the state of Utah. There are a few issues, I think, in the world that we deal with in terms of more uncertainty than addiction and overdose. And, community organizing is really about a shared story and shared principles and how we relate to others. That shared story, which is a practice, it's a craft called public narrative. It's figuring out your self story, the story of self. It's about figuring out the story of us, how to tell this story of myself and the community, right? The community you're trying to build empathy with. And then the story of now, what you want your community to do. That shared story leads to commitment towards specific goals. It leads to building structure and building teams, like-minded teams. It leads to working with those teams to build a strategy, right? In this case, the strategy is combating overdose and providing more resources so that peer support specialists, we can build more capacity for them, right? And we can have more funding for that. And then it leads to action. What is that action going to be? Now, there's three fundamental questions, right, that we all ask ourselves when we get into kind of this recovery community organizing work. Those questions are listed right up there at the top where you say people, change, and power, right? The three fundamental questions are, who are my people? The second one being, what is the change that they need? And the third being, how can we turn the resources that we have into the power we need to achieve the results that we want? Now, I know, when we hear the word resources, we oftentimes think, what does that mean? Anybody? Money, right? People hear the word resources and they think money. I can tell you resources, more times than not in our organizing, is everything but money because we don't have it. Some of the most valuable resources that we have, it's our feet, it's our voice, right? It's it's people, right? It's the ability to show up with people power versus money. That's something that we've got as a recovery community, that we haven't figured out yet, and I think we're on our way to really, put into full force for the maximum benefit of ending this catastrophic overdose crisis and providing solutions. When you think about the math is really on our side, right? There's about 23 to 24 million Americans in the United States who identify as people in long-term recovery. There's another 40 million Americans right now who are struggling, who need help. 40 million Americans. That number has doubled since before the pandemic, right? That's a lot of people. If you're to household that, and you're to say, well, what about people who are directly impacted? A mom, a dad, a brother, a sister, right? It's about 1 in 3 American households. Imagine you don't need every single person to get up and say, you know, I'm an impacted person and I demand change. What if 2% of them did that? What if the ones who could actually were loud about it? I could guarantee you that solutions would be quicker to come. Sadly, though, still in 2022, you know, many people have to live their recovery in silence and don't have the ability to recover out loud as much as many of us do. That's because employment discrimination is still a very real thing for people in recovery. Life insurance discrimination is still a very real thing for people in recovery. You know, in the criminal justice system, you know, it can be used against you if it's some sort of case that has to do with children or custody. I mean, these are real things still today in 2022. But we are making progress, right? And it makes it more important for those of us who are able to recover out loud and be vocal about our recovery to do it for those who can't, right? So that hopefully we can build a place one day where we'll all be welcomed. So given, again, the time constraints this morning, I'm going to focus on one particular part of this, which is the shared story, because I want to share my shared story with you in a second, otherwise known as the public narrative. This is what's known as, what I was saying earlier, the story of self, the story of us, and the story of now, where I come from, you know, where my agency comes from to do this work, why I do this work, and how our shared story and our values can help, you know, craft forward-thinking public policy here in your state and around the nation that will support our community and support those who need help. These, you know, this is not something new, by the way. This was new to me in the recovery advocacy space, but this is not new to movements here in the U.S., both progressive and conservative, right? Organizing these exact tactics have been utilized for decades on everything from healthcare movements to LGBTQIA plus movements to you know, the Affordable Care Act, you know, 10 years ago, back to the civil rights movement. I mean, these were the tactics that the folks who rode the first Montgomery buses during the civil rights movement have used. It's the same type of tactics that we are starting to employ in the recovery advocacy movement. Now, specific to the shared story, I learned on an early recovery, right? When I first got sober, we like to tell our stories, right? Like it's one thing we do within our own personal recovery movement, and we're in our own personal recovery space, whether that be 12-step or another recovery pathway. We like to tell our stories, and we do it pretty good, right? It's something, one of the first things that we feel very liberated when we do that within our own personal recovery programs. And it is important, and there is a craft to that. And we're good about sharing them within the recovery community and our recovery program spaces. But I also learned, you know, when I started to understand the craft of public narrative, that while we're really good at doing it in personal recovery spaces, we weren't that great as a whole in the recovery space about making them into an effective public narrative that would relate with folks who may not have anything to do with recovery, right? Or really know much about recovery. We were typically used to sharing it in the context of, you know, what it was like and what happened and what it's like now, and not really going through this you know, shared story format, which is a very different type of craft. So I'm gonna share my public narrative with you that I use when I go in front of larger groups of people outside of the recovery space. in more public forums. The official definition of public narrative is used in the context of organizing, and for the note takers, here's another one. Public narrative it's another leadership practice. It's a leadership practice of translating your values into action. It's based on the fact that when your values are experienced emotionally, right, in the heart by other audiences, they could be the sources of worthy action, and they could have the capacity for change. So when I get the opportunity to speak to outside audiences, I'll usually start with this, brief 15, 16-minute version of my public narrative. And when I get to share it, with peers and folks in the recovery space, it reminds me of, what my why is, why I do this work, why I decided to get into recovery advocacy. And I'd like to share it with you all this morning. It's really where I get the fire in my belly for this work. So I'll never forget, I was sitting in this old beat-up lounge chair on the deck where we had used to have our Saturday morning meetings, and it was this really early and cold morning, almost 6 years ago in Pasadena, California, and the mood was confusion. We had sat around in this circle like we always did for our Saturday check-in meetings, our weekend check-in meetings, but this one felt really different. You could tell, by everyone's faces, something was wrong. It was really silent. You could hear a pin drop. And at this point in my life, I was really holding on for dear life. I had walked into that recovery house less than a year earlier with nothing but the clothes on my back. I had 2 plastic trash bags. I was on public assistance. I had no job. I had no transportation. I suffered from severe depression. I had a tremendous amount of unresolved trauma. I was confused, but more than anything else, I was just, to my core, I was really, really tired. And I knew how hard it was to just hold on moment to moment. And some days I wanted to just completely throw in the towel, and I wanted to give up. I wanted to go back to where I felt I was most comfortable. And that place was in isolation. It was on the streets. It was panhandling on the streets of Hollywood and Highland in downtown Los Angeles. It was wandering in this never-ending spiral of chaotic drug use. And as dark as that description sounds, that's really where I felt the most welcomed. That's the place where I didn't feel I was judged. That's the place where I didn't feel I had to worry about being told that I was different and that I didn't belong. And on those first early dark days in recovery, when I felt like there was no end in sight, oftentimes I'd pick up the phone and I'd call one of the only people who were still talking to me at the time, and that was my mom. My mom, who was nearing her 70s at the time, she always answered the phone and had some sort of wise and very calming word to share with me. She would talk to me in this very slow and pleasant tone. She would remind me that I was going to get through this. She'd remind me of the time when I was 15 years old and my dad went to federal prison and our family lost everything. That I'd stay up late at night with my little sister and I'd do homework with her while my mom was out working her third job, just to keep clothes on her back and to keep the water on and the power on and food on the table. I can remember so many times when things were extra tight. My mom she'd go make this weekly stop at McDonald's. I'm 41 years old. Many of you may remember this, but they used to have this 29-cent hamburger day, 39-cent cheeseburger day. And my mom would go through the drive-through, and she would get 50 or 60 of them, right, and put them in the freezer, and that's what would feed us for 2 weeks, because she'd be out teaching night school and working her third job until 10:30 at night. she'd remind me and she'd say, as long as we stick together as a family, that everything would be okay. My mom, she never gave up. She never gave up on me, and thank God she didn't. But even though we had, each other, loneliness was this defining theme, for my family. The better part of my teenage years, we were pretty much unwelcomed at places I had grown up in, such as the church. Our family story of my dad's incarceration was really big news in our small town. People that we had spent holidays with, that I grew up with, that we would, spend Sundays with, they started looking the other way when we walked into Sunday worship services. And it felt as though we were no longer welcome, that we were different, and that we were on our own. And when we would be shunned or forced out, whether it was from the church that I had grown up in and received my first communion in, or the house that I grew up in and we were kicked out of, when it felt like we were on the brink of utter and total collapse as a family unit, my mom would be our backbone and strength. And she'd tell us that it's going to be okay. She'd tell us that one day we could build a better home. One day we could build a place, where maybe we do belong. And she'd remind me that when all seems just dire and bleak in the world, that, we could always hang on to something, that we like to call hope, and that hope maybe could carry us to a better place. So I completely understood, to my core, when my roommate Nick came home to me the night before and he had told me he had lost all hope. I knew how he felt when he told me he was using again and he couldn't stop on his own. Nick wasn't just any roommate, he was my roommate. He was 24 years old and he had the whole world in front of him. But Nick didn't think so. He was afraid. And he was begging for a way out. He told me that night he didn't feel like he could call his job or call his family. He had no insurance. He had no money. He had no absolution in sight. He was afraid he was going to get fired if he went to his employer and shared this with him. And to top it all off, Nick was going to be unwelcomed at our sober living, our recovery house at the stroke of midnight. The rules were the rules of this house. I had no power over it. They wanted him out that night because he had a recurrence of use, and I felt, simply put, that night powerless. And I can remember looking at the clock, and it was 11:43 p.m., and thinking to myself, what are we going to do? What's the plan? Where can we send Nick to? Where is he going to get help? There were no 12-step meetings that were going on that night past 8 p.m. He couldn't stay at the house. There wasn't a treatment facility that was going to take him because he didn't have the money. And I thought to myself, wait a second. It's like, isn't there a hospital like a mile away from here, that has a mental health unit in it? And shouldn't they be able to accept my friend there? Shouldn't they be able to get Nick in there, get him some help, maybe get him detoxed, and then he can come back to us, after 3 or 4 days at the hospital, because that was one of the rules at the sober living. If you get medically stable, you could come back in, and then we as peers could do our job and, lift him up, get him some support, and do what we do. And we thought not only was that a sound decision, but it was probably the only decision that we had that night. So I thought, let's do that, and that's what we as a group suggested to Nick, and got him over to the hospital that night, and that was it. He went to the Pasadena hospital, and that was the last time we saw him. He went into that hospital and he waited. When Nick got there, he was treated as if he were a second or a third class citizen. He wasn't even seen by a doctor. He showed up. He told him he couldn't stop using heroin. He told him that he was fearful what was going to happen to him if he went back out on the street. He begged them to give him some sort of reprieve and give him a bed for a couple of days, if not to check him into a full program. And they said no. Now imagine this. This isn't just any hospital. This is one of the most renowned hospitals in Southern California with $1 billion endowment fund. Okay? not just some rinky-dink hospital. This is a renowned hospital. These folks told my friend Nick that they couldn't help him. And instead of getting him qualified that help that night, they sent him on his way with a white piece of paper at 1 a.m. in the morning with a bunch of hotlines on it and told him to try and call them the next day if he was willing. I think everybody in this room particularly knows what that feels like at some level. We all know what it feels like to be turned away. We all know what it feels like to be told we're unwelcomed. We all know what it feels like to be told to try the next house on the block. The next morning, sitting in that chair, I knew what was about to happen. The owner of this house had us circled up, and I knew it wasn't to break great news to us. And then he started speaking, and he said something like, guys, this was an all-male house. He said, guys, this is just what happens. He goes, Nick overdosed and died last night, found his body about 3 blocks away from the house. He had actually slumped over on a sidewalk and had used one more time. And then he closed by saying something like, this is just what I've been telling you, since day one. And that's that sometimes people have to die so that others can recover. And to this day, and I know this is a popular cliche in some recovery programs, but I'm just going to put my cards on the table. Nothing makes me more angry than hearing that statement sometimes. I can tell you for certain that my friend Nick did not have to die that night for me to be able to be here to share this story with you. And it took me months to understand what happened that day. Nick was always top of my mind wherever I went, and he is top of my mind when I'm here sharing this story with you today. I didn't know it then, but his death had sent me on this journey to ask this question, why? Why is this happening to our community? Why is this happening to my community? Why is this happening to people I love? And in the summer of 2016, that journey led me to the Union Hall right down the street from the sober living that I was living at. I showed up there with over 100 friends of mine, friends of Nick's, friends of other friends, friends of folks that we had lost to overdoses that year, to stick that question to our community, why? Now, it was an election season, summer of election season of 2016, and caucuses and primaries were going on all across our state to elect delegates to their national party conventions to nominate their candidates for president. And by this point in my early recovery, we had already buried, this was about 1.5 years in, we had already buried over a dozen friends and people we loved and cared about. And we were desperate for a solution, but we were equally desperate for people just to start listening to us. And it had made me remember these days. When my mom was working late, she used to have me go to my grandmother's house where we'd stay until she could pick us up. And my grandma, to help occupy the time, she'd take us to like a community town hall or like a city, council meeting or like a county commission meeting to just bridge the time till my mom would pick us up. And she'd sit in like the seats with us, and she'd pull out the agenda, and I was maybe 13, 14 years old. My sister was like 6, 7 years old. And she'd be like, this is how laws are made, and she'd tell us, this is how we're governed. This is how things happen, here in our city and around our country. And she'd teach us how civic participation worked. And that year, when I entered 6th grade, I had arrived at this new school once again as an outsider, and I was looking for a way to find belonging. And so I ran for class president. And I had put up posters, and I called my classmates, and I visited people I'd never met before at addresses I found in the yearbook. And I took this idea of creating 6th grade policy change dead seriously, right? And that year I had won that election, and it was the first time I can remember as a young adult who was struggling with a lot of identity issues that I finally felt like I was a part of something. So in a sense, I was hardwired for this type of solution when my friends in recovery and I showed up to this union hall in 2016. It was now like my second time with my name on a ballot. And although this time it felt like a very far departure from sixth grade, I knew that for us to be heard, that we as a community had to step up and be a part of spaces that we traditionally hadn't been active in before. And we had decided as a community a few weeks earlier that our organizing strategy would be to register me as a candidate to that national convention, which would at the very least force our community to hear us for at least 30 seconds. I was going to have the opportunity to speak to about 700 members of the community and ask them to do something about these overdose deaths that just didn't seem to stop in our small community of Pasadena. We had zero intention to win that day. All we wanted to do was to be heard. But the result of what happened was something that has guided me from day one of my advocacy. We showed up that day, over 100 of us, people in early recovery, people who had just gotten out of prison, people who had previously been homeless just a few weeks prior, had just gotten out of treatment, registered to vote. We showed up that day feeling like complete outcasts, but when we left, we felt like we were a part of something. We worked this line of hundreds of people who were waiting outside to cast their ballots. We fanned out into groups of 3 or 4 to share our stories and to share the stories of those who we had lost that year. And much to our surprise, every second or third person, we couldn't get 30 seconds, a full sentence out of our mouth without them turning to us and sharing with us how they had lost a loved one to an overdose, how they had grown up in an alcoholic household, how their brother or sister was either in treatment or had just completed treatment. I can vividly remember one 73-year-old woman telling me in that line it was the first time she had talked about her 23-year-old granddaughter who had passed away the year prior down in Dallas, Texas. And it felt like our community had been waiting for the permission of folks in recovery to share their own pain and to share their own experiences. It was one of the most profound and powerful days of my recovery. I'll never forget it. We were what they call community organizers that day. We just didn't know. We didn't have a name to put to it. So let me make something clear. It's through my personal recovery program, which is completely separate from the work that I do in advocacy, that I found resiliency and community. But it is through organizing and organizing with and for recovery that I have found a passion for change and a purpose in my life. Now, many of those community members that day, they've gone on to be some of our biggest champions in recovery advocacy. They've helped us champion life-saving legislation such as mental health parity, opening up the first ever sober home standards that were published by SAMHSA 2 years ago, fighting for the first ever 10% set aside in the substance abuse and mental health block grant, which your state is going to be an extraordinary recipient of and translate into real dollars in 2024. These people have been our champions. And I think it's important for us to remember that right now, there's nearly 40 million Americans just like my friend Nick, right? Just like Nick, who are being told that they're unwelcome. People who are struggling with a substance use disorder. The vast majority of them are being told they're unwelcome to treatment. They're being told that they're unwelcome to housing. They're being told that they're unwelcome to the critical long-term supports that saved many of our lives. Each and every one of you, our community, we all have the power to change that, within the system and outside the system. And we need your help. We need your voice. We need your passion to help convince those who are making decisions about us to stop making them without us. Now, I'm going to take a pause there for a second. what I just went through is my public narrative. I don't know how I clocked it. I went a little bit slower, but it's usually about 16 or 17 minutes. That is a craft that we developed to share to outside audiences. And you can tell it's very different from the story that I would share within my personal recovery program. And as you can tell, it does not talk much about kind of the devastation of my addiction days. I could have probably spent 45 minutes talking about panhandling on cities of Los Angeles and things I don't like to recall that I did, right? But instead, you hear about, what pushed me into this work, which was the death of my friend, Nick. Audiences want to know, well, what is it, where do those values come from that led me to that union hall? Well, it was when my grandmother taught us how civic participation worked, right? Where does my agency for change and hope come from? It comes from my mom, who never gave up on me, right? Who never gave up on our family, right? And you build what's called an empathetic bridge to folks who may not relate with us, but can relate with those emotions, right? And what's one kind of universal emotion that I think everyone, no matter where you come from, can relate to, and that's a sense of belonging, right? It's wanting to be welcomed into a community, right? Like that's a universal empathetic emotion that we can share with folks. So I'm going to skip through a little bit just in the interest of time, because I do want to leave it for some questions, and I have a few other things that I want to go through. But I do want to say, specific to the craft of public narrative and the work that we do on the ground as recovery advocates, there is a way for you to get involved. There is a way, and there is no cost to you, right? This is something, an initiative that we raise money for every year called Mobilize Recovery. We realized as a community, a national recovery community, that a lot of people want to get into this work. They're peers or they work in treatment, but some of them just don't know where to start, right? And so the idea around Mobilize Recovery, which started in 2019, was to give peers and give individuals and family members impacted the tools and the tactics and kind of the quote-unquote inoculation that you need to kind of ramp up your advocacy efforts in your community. We do a full day session around the craft of public narrative led by Harvard Kennedy School. You can receive CEUs for this work if you need it. We issue them. All you need to do is go through a short application process. We accept virtually all peers that apply to it, as long as you mention you're a peer. And you can find the application online at mobilizerecovery.org if you want to write that down. It's a 3-day event. It's been supported and attended by, last year we had Macklemore as one of the participants, and Sir Elton John and Demi Lovato, and folks that you can recognize in recovery who have been big parts of this initiative and help bring it together. We try and match, bring peers together to help build that constituency of consequence. It's trained over 1,500 new advocates just in the last year, and over 4,300 total in the last 3 years. Now, what Mobilize Recovery does is we then have an organization called the Recovery Advocacy Project, another nonprofit that you can work with year-long, right? This is something that you can engage with all year long. It is the backbone of our work in the recovery advocacy space. We work with groups such as Shatterproof and Faces and Voices and others. The only difference between the Recovery Advocacy Project and some of these other organizations is that we are hyper-focused on building local capacity of advocates versus just training advocates who are going to show up in Washington, D.C. and testify in front of Congress once in a while. Like, we really want people to get involved in their state legislatures because oftentimes this is where the most critical decisions come down. And the description of RAP is up here. It's a network of people and organizations across the country advocating for addiction recovery policies. We're committed to giving people in recovery, family members, supporters, the grassroots tools for free to think and act locally. We do have an active coalition here in Utah that you can get involved in. We'd love to have you as a part of it. We held over 1,300 organizing meetings around the country last year, over 108 community listening sessions, and had over 19,000 actions, unique actions that were taken to support peers in recovery. So as I said, each state and your state here, we're organized into state teams. These teams, and again, this is all volunteer. We go out and raise money from individuals in recovery who want to support this work. Your state here brings together like-minded individuals that want to work towards change, right? That want to work towards some common policy items, that maybe have identified some gaps in the system that need some addressing. They meet bi-weekly by Zoom. There's a national training that happens once a month on things such as empathetic bridge building, organizing tactics, and public narrative. And we have exclusive Google Classroom content that pretty much will answer any question you may have specific on how to organize your local recovery community. And it helps you build your state advocacy one step at a time. It's not RAP's goal to come in and be another big, bad, 800-pound gorilla organization that's going to dictate an agenda for your state. That is not our goal whatsoever. Our goal is actually to provide you with the resources to create your own emerging organization or resources to supplement things that may be going on in your state already, and to support your work. It is by no means for us to drive an agenda. It's for you to determine the agenda and for us to help support whatever that agenda may be. Last year we had our first ever Public Narrative and Organizing Institute training. It's something that would be open to all of you, again, for free. And you'll receive CEU credits if you would like to look into it. Throughout 2021, over 32 organizers from around the country participated in a long-term public narrative training. Coming out of it, I'll just share with you, we had House Bill 2257 was beaten in West Virginia. This bill would have been detrimental to the recovery community in West Virginia. It extended supervision for people convicted of certain drug crimes for up to an extra 10 years for things such as simple possession. We had a team that went in to utilize the craft of public narrative and learn it. They used it and successfully beat that bill 2257 dead. We actually have someone in recovery who came out of the Institute who's now running for Congress in the state of Maryland, right? Talking about this issue. We have 3 people who are running for the state legislatures, right? Who have figured out, and these are peers. These are peer support specialists, right? 1 running for the United States Congress and has a great shot at it, Maryland. 3 running for state legislature, one of them who is definitely going to win, I can tell you, right? Like, people in recovery are finding their own agency of power through this work, and they're not just showing up as advocates, they're getting right into the middle of the fire. And that is kind of the evolution of this movement, and it's exciting. It's exciting to watch and be a part of. It's important to know all of this work is grassroots. I'm only speaking for Mobilize Recovery and for the Recovery Advocacy Project. We don't accept pharma money. We don't take pharma money. We don't take money from addiction treatment or big industry folks. It's mostly run by volunteers. We run on a slim budget, we run on small dollars. And we try to steer clear of conflicts of interest because we have seen more oftentimes than not that when sometimes big money from certain industry gets involved in our space, they start to drive an agenda and they start to co-opt us, and that can be a problem. So, getting close to done. Organizing tools that are available to all of you that you could check out, recoveryvoices.com. We have advocacy guides. We have a recovery voter hub. We have model legislation from other states that has been successful in supporting the recovery community. where you can take it to see if you could implement it in your own state. We've got digital organizing tools for you to build your own email lists, create your own networks. We have, like I said, the Google Classroom content. Within that, we have everything from Mobilize Recovery 2020 and 2021 in there, so you can get up to speed, and grassroots and community organizing trainings. I want to just encourage you, if you haven't already, please sign up for Mobilize Recovery. It's mobilizerecovery.org. The deadline for this year is June 30th, so there's about 3 weeks left. If you haven't signed up yet, we'd love to have you and love to have you involved. So what's next, right? What's next in 2022 and beyond? Overdose crisis in the United States is now largely and majority driven by synthetic opioids, right? Which means predominantly illicitly manufactured fentanyl. Overdoses involving psychostimulants such as methamphetamine are also increasing, both with and without synthetic opioid involvement. So this, I'm going to try this little laser thing out just because I have it. Let's see. There you go. That green line, right? This is very cool. That green line right there, that's fentanyl, right? Prescription opioids, prescription drugs is no longer our leading cause. Fentanyl is. The ground beneath us as advocates and as peers is completely shifting on a daily basis. This means that the way that we approach curbing overdose deaths and providing supportive services to our community and the strategy that we use on how we approach this crisis has got to change. Because let's be honest with ourselves, right? I'm not saying we as peers, I'm saying as a country, as public policy, if what was working, if what we had been doing was working in terms of policy and funding and priorities, we wouldn't be where we're at today, right? Just from a pure, simple data perspective, we wouldn't be where we're at today. Traditionally, federal government, the United States federal government, and state governments, including your own, they used to focus on three key areas. They had interdiction, which was law enforcement, prevention, and then they would couple treatment and recovery together. How many times do you always hear treatment and recovery as one word almost? You don't hear treatment, pause, and recovery, right? So that it has kind of its own funding infrastructure. As you can see now, the new HHS overdose prevention strategy, and this was released at the beginning of the year, now focuses on primary prevention, harm reduction, which for the first time ever, the federal government is recognizing harm reduction as a primary prevention strategy, which we have to, and it is long overdue. Evidence-based treatment and recovery support on its own. Recovery support meaning recovery community organizations, recovery housing, peers, peer recovery support services, infrastructure for peers, right? Building up a workforce of peers. We've got the data that has shown that this is what it should be since 2016. In 2016, the United States Surgeon General released the first ever national report on alcohol, drugs, and health. In that report, it stated that if we could get people up to past 5 years in sustained recovery, guess what their chances were of maintaining that recovery for the rest of their lives? Over 85%. Over 85% of people who make it past 5 years in recovery sustain that recovery for the rest of their life, right? So why is the goal not to get people up to 5 years or more? You think that would make the most sense? Well, that's because, sadly, treatment and recovery support services have been bundled together in terms of a funding infrastructure for too long. And my apologies to folks who are maybe attached to treatment here. Treatment saved my life. I am a big supporter of treatment. But there is a lot of co-opting that goes on between the treatment industry and what recovery support services are that peers provide, you know? We have to have our own funding infrastructure, and we have to have it so that we can build more capacity for people to get help, because the other data point that hasn't changed in many years is the treatment gap in this country, continues to stay stagnant at 90%, right? So only 90% of people who need treatment aren't able to get it. Only 10% of people that are qualified for treatment, need treatment, are able to ever access treatment because the barriers are so high. And that has to change as well. So last thing I want to call your attention to is kind of closing up on this what's next piece. The president's fiscal budget for next year is now calling for $11.2 billion across HHS, which is $3.9 billion more than received in 2021 and 2022. SAMHSA's budget for the block grant will include a $3.5 billion request. The most important thing out of this, though, that is the result of advocates fighting treatment. It's the result of advocates fighting industry, and actually in many cases fighting state agencies, is there will be a 10% set aside for recovery support services. Prevention has had a 20% set aside for many years, decades, since the beginning of the block grant. Recovery has not had a set aside. Recovery will have a 10% set aside if this budget is approved in the fall, which will translate into $350 million for recovery support services and recovery peers to be distributed by the states. This is the hard work of the recovery advocacy space. So in closing, I just want to thank you all for what you do. I want to validate the importance of your work. We need you. We need you on the front lines. I will continue to do all that I can. I know that the team, Mobilize and Recovery Advocacy Project, is going to work hard to continue putting peers front and center, because I believe it is the next frontier in terms of how do we close that treatment gap in this country. How do we, cut that treatment gap in half? I believe it is through peer recovery support services. And thank you all. Thank you for welcoming me to your beautiful state. And if there's a couple of minutes, I'd be happy to answer any questions. And that's it. Thank you all.